Good morning, good morning, good morning. It is bright and early on a Saturday morning here in Greenwood, South Carolina. We have a very, very rainy day today. I am on a couple minutes early because I want to give people time to start to hop on and ask questions. So if you're watching this live, I would love for you to comment live in the comments. If you're watching this on replay, please put replay in the comments. That way I can keep track of who's watching, who needs help, who has questions afterwards. I do actually answer the questions for people as best I can to the best of my abilities. It is Saturday, February the 13th. It is 2021, and this will be episode 12 of this 1 hour long Facebook Live to answer your questions regarding dementia. I am just going to sit here for a couple of minutes and talk, and then I'm going to start with a little blurb. I've been working very hard in the background on becoming becoming better for you guys, becoming better for the people that I want to serve, or I hope I'm serving. I am so happy to be here. I hope my sound and my voice and everything is doing well. Good morning, Eunice. How is sunny South Africa? We have some rain here today. Thankfully, it is not snow. So I'm going to do a quick little introduction. I'm working on making things a little bit more streamlined and actually a little bit more, what's the word I want to use? I want to make it a little bit more structured so that I know what I'm doing and so that you guys know what to expect. So it is about 8 o'clock in the morning. I'm still trying to find the best time to do this. A little bit later this afternoon, well, actually immediately after this, I'm going to be presenting a conference on dementia for the South Carolina Occupational Therapy Association's annual conference. So I am super excited about that. My phone just dinged, so I just realized I need to switch the sound down. So there we go. Oops, it is down. Good. So here we go. Welcome to the Baffled Brain. Demystifying Dementia. This is an hour-long Facebook. Excuse me. Let's start that one over. Welcome to the Baffled Brain, Demystifying Dementia, the hour-long the hour-long Facebook Live that will teach you everything you want to know about how to manage dementia. Today is February 13th, 2021, and this is episode 12. And I am your host, Lizette Cloete from Think Different Dementia, where we believe caregivers deserve reliable answers to prevent burnout and improve their quality of life. Nobody should navigate this journey alone. So, I have a couple of questions that people have asked that I try to put a post on earlier, and one of them actually is Miss Eunice. So I'm going to start with Eunice's question because I know Eunice is on there. So good morning, Miss Eunice. I am so sorry it's so hot in South Africa. It is cold and wet in South Carolina. I'm not sure which one I would prefer. So Eunice and I have had a long-standing conversation back and forth, and so I know a little bit about Eunice and Eunice's life, and I know Eunice's mom recently passed away within the last 2 to 3 weeks. And we had been working together on this live to answer some questions for her because people in South Africa do not have a lot of resources. I don't know about you guys. I don't know whether you all know this if you live in the United States like I do, but people in other parts of the world really have very limited resources regarding dementia. I know that here in the States sometimes we feel like we don't have enough resources regarding dementia, but people in other parts of the world really do not have any resources. So I'd been working with Eunice over Facebook and over Messenger, and actually WhatsApp to help her with her mom over the last, probably since maybe August, September last year. We kind of walked together. I am from South Africa originally, born and raised, and so I know the challenges there. So Eunice had a question. Does your mindset change when you lose a loved one? She says, I forget more than when my mom was alive. So Eunice, here's how that works, right? So when we have everybody's cognition, nobody's cognition is static. You, me, anybody else on this replay or live, nobody's cognition stays the same. We have good days and we have bad days. Everybody does. But we have a baseline, right? So normal people like you and I, we have a baseline. We're around about the whole, certain range. And that is normal. If we're sick, our thinking is not as good. If we are tired, our thinking is not as good. If we are stressed, our thinking is not as good. When we have major life events happen to us, because that causes stress, right? Our thinking is not as good. So it is not at all uncommon for people who have lost somebody they love and somebody they've been taking care of. It is not at all uncommon for them to have changes in their thinking processes. This is normal. It is not something to be concerned about. It is something that will improve over time. You just lost your mom who you took care of day by day, day in, day out for years. And it is expected. It is absolutely expected. It isn't really cognitive loss per se, like we would talk about people with dementia who have cognitive loss, but this is a normal part of the grieving process, a normal part of anybody who has had a major life change. This should get better again over the next several weeks and months, but if it doesn't, I want you to reach back out to me and let me know, and then we can certainly take a look at if there truly is other stuff going on or if there are other things that I can do to help you. So Eunice, I hope this helps you. I hope this sets your mind at ease. The more you stress about it, the worse it'll actually get. So I don't want you to stress about this. And then Lori is somebody that I also what I'm finding is there are a lot of people who kind of start to develop a relationship with me, and so Lori also asked a question in my private Facebook group. And I would love people on the live to please ask me questions. That is how I keep this thing going for about an hour. I usually have 3 or 4 questions that I can get started with, but I'm reliant on you guys to actually ask me a question, and I want this to be a dialogue. I don't want this to be me sitting here talking and rambling on and on about me and my life. This is my gift to you. This is my serving you to try to answer questions. I don't know if a lot of you guys know, but my background in training is I am actually an occupational therapist. So this is not occupational therapy. This is just consultative. This is just answering questions. But my goal is to be a reliable source of information for this group. So I need you guys to help me actually ask me questions. So I'm going to answer Lori's question now, and then I'm hoping that somebody will ask a question so we can kind of keep this going. So Miss Lori said tomorrow, which I don't remember when she posted this, but she's going to get the Moderna vaccine, and she wants to be ready if she can go visit her husband in the nursing home. So part of what happens as I'm doing these live streams is I'm developing relationships with you guys, and so Lori and I have been dialogued back and forth. So a little bit about Lori's background. Her husband lives in a nursing home, and she has been, like a lot of us in the COVID situation right now, not been allowed to go see her husband. So her husband lives in the nursing home, and she has a question about the vaccine. So she took the Moderna vaccine, and her husband has had the Pfizer vaccine. He's had 2 doses in January. And so her question is about the vaccine for Alzheimer's disease. And so I really don't know yet, Lori. That's a really super great question. I don't think people really know. Her observation was he seems to be sleeping more when she's watching him on the video calls. We know her husband is in the late stage and has a lot of difficulties with talking. He cannot answer back, cannot tell anybody how he feels. She observes that he looks clean and fed, and she wants to know, will the vaccine cause the dementia to progress? Well, I will tell you, Lori, I think that's a really great question. So I full-time work in home health still, and I am seeing a lot of people now. The vaccine has been coming out over the last several weeks for people with 70 and above, and now 65 and above, at least in South Carolina. And I can tell you that it's like any vaccine, it's like anything that's new. I don't think we know enough. I really don't think we know enough. I don't think we know enough about how the vaccine impacts people with dementia. I can tell you that I've had a handful of people who have not done well after receiving the vaccine. But having said that, I don't think you should avoid having the vaccine, being afraid of maybe a negative outcome of the vaccine. I would be more scared of COVID than I would be of the vaccine. At the beginning of COVID, I was kind of back and forth, back and forth, back and forth. But I will tell you, the longer it's going on and the more patients I see, clients I see over time, who have had who have had COVID versus not had COVID, it is like, whew, there is such a range. Some people have nothing wrong. Some people have, like, oh my word, it's like some people are never the same again. And so it's like, I don't think we know enough about COVID, and I definitely don't think we know enough about the vaccine. But at the same time, I think the vaccine is the only way to go to protect ourselves and to protect our loved ones. Having said that, I would be, your husband lives, Lori, back to you, your husband lives in a nursing home. And in order for him to be as protected in the nursing home as he can be, I think it was the right idea, because one of the things you said is, did you harm him by consenting? No, you did not harm your husband by consenting for him to have the vaccine. Does the vaccine cause the dementia to progress? I don't know. I don't believe so, but I don't know. I think the vaccine may sometimes, kind of like when somebody has a urinary tract infection, maybe changes things for them a little bit. My hope is that as we talked about with Eunice at the beginning, if this is your husband's norm, right, and he had the vaccine and he kind of declined, maybe a little, that 2 to 3 weeks from now he'll be back to where he was before. Or did he maybe just continue to stage with his dementia? I don't know. I don't think anybody can know. But like a urinary tract infection, right? This is somebody's normal baseline thinking processes, and then they have a urinary tract infection. So my opinion, because this would really just be my opinion is that he likely might have just had a little bit of a decline, because the vaccine is supposed to make our we're supposed to have immune system response. So I'm hoping that that's what happened. And to set your mind at ease, I do not think you did him harm by consenting for it. But let's just talk about it this way around. If you have loved ones, or if other people have loved ones who they have consented to have the vaccine and they have dementia, we know right now, if somebody's in the later stages of dementia, that ultimately, right, dementia is something that will continue to progress. Even if it has changed their functioning, I still would do it. I would be cautious and careful. I would reason through it. I would think about it, but I definitely would not do it. So I hope that answers your question. So thank you, Miss Gina, for hopping on. I'm glad to have you here. Miss Lisa has a question. So I got to put my eyes on, because I'm getting old. I'm 50 years old. I can't see here. I can't see there. I got to do the in-between thing. So her dad is in the late stage of Alzheimer's, and he has no idea that she is his daughter. Her question is, how long does the inappropriate sex talk last? It makes you extremely uncomfortable, and I'm just kind of playing it like no, Dad, only my husband can do that kind of stuff. Well, Lisa, the first thing I want to say is, oh my word, what a difficult situation. I'm so, so sorry for that. I truly am. Late stage dementia, I'll break your question down into subcategories. Nobody needs to nobody nobody needs to talk to you that way. And yes, I am 100% aware that that must make you extremely uncomfortable. So let's just break this down. So Dad has late stage dementia. I would assume from your post, and this is just an assumption, that your dad might actually still live with you, or live with you and your husband. If you can throw that in the comments for me, that will help me tailor my answer to your question a little bit more. So remember, when people are progressing through the stages of dementia, they truly lose a little bit of themselves every single day. Uh, I know that you know that your dad would not have done this to you had he been in his right mind. You say he doesn't know that you're his daughter. How long does the inappropriate sex talk last? That I cannot answer. However, I can try to give you some strategies that you can try to see if it'll help. Because behavior usually has a trigger. And the trigger can be the person, what's going on with your dad himself, the environment, what's triggering him from the environment, or the caregiver himself. Without knowing more detail about when he has the inappropriate sex talk, what he's saying, is there a physical component to it? All of these very specific details really make a difference in how to answer a question, or how to actually manage the challenging behavior, right? So there are a lot of things, Lisa, that you can do. This is not something you just have to tolerate. You do not have to tolerate it. If your dad doesn't know that you are his daughter, reasoning with him and saying, only my husband can say things like that, may not necessarily stop the behavior. You're going to have to try various different things to see what is or what isn't causing it. So you have how to look at behavior is that behavior is in the middle. So it's called the ABCs of behavior, okay? Or the antecedent, what happens before, the behavior itself, which is how long does the inappropriate sex talk last, and then the consequence of it. So usually we want to try to stop it before it happens. So what I want you to do is you're going to have to do a lot of homework. I want you to make a diary, a behavior diary for yourself. So on the behavior diary, you need to, every single time that the behavior, the inappropriate sex talk occurs, you need to look at what happened right before. Is it a specific, like very specifically, time of day? Who's there? Caregivers? Is it only with you? Is your husband there? What is the activity that is going on? Is it specific places in the house? Is it during specific tasks? Write down the specifics. The more specific you can be about what is going on, the more you can use that to try to figure out how to stop that inappropriate sex talk, right? So you want to also look at the consequence afterwards. Is he getting something from how you're reacting, right? If you overreact, what is the consequence to to what happened. So you got to be specific in your dementia diary, in your behavior diary. Then be cautious about it. So he really doesn't know who you are. So he is not doing it because it's inappropriate to you. It's we're sexual beings. It's a behavior to him, right? He can't communicate his needs, wants, and desires anymore. So just downplaying it is good, but maybe not using, only my husband can do that. Maybe, what if your dad thinks you're his wife? Now you're telling him your husband, which he thinks is him, can only do that kind of stuff. Remember, daughters tend to sometimes favor their mom in appearance. And as your dad is progressing through this disease process, you may actually look like your mom might have when you guys were young, when they were younger. And so your dad might be thinking that your mom. So perhaps telling him only your husband can do that won't stop the behavior, because he might think you're his wife. So what I would kind of say is, I wouldn't even say anything like only my husband can do that. I would just kind of not say anything and try to move on and change the context, change the conversation, change the activity. I hope, I want you to try some of these things, Lisa, and get back to me. You can message me on Facebook and let me know. Throw in the comments over here if you think if you think I answered your question well, and whether you have some actionable things that you can take and try. And then let me know how it goes, because nobody wants to talk about these inappropriate sex comments that people have. But it's just try to think yet again what happened before, what happens during, or the action, right? What's he saying, and then how you're responding to that, and then the other thought and the other thought process, the other side of it, sorry, can't speak. The other side of it is, when is the behavior not happening? So if you can diarize, you have to diarize, you have to write down when it happens, and you have to write down when it's not happening. And then when it's not happening, look and do the whole same exercise, what happened before. So you can you want to try to keep tailoring and tailoring and tailoring your responses to get closer and closer to not making that behavior happen again. So throw out in the comments there, Miss Lisa, whether this was helpful to you, and I hope that I answered your question. So Miss Andrea says, I have early onset Alzheimer's. What can I do to help my balance? So Miss Andrea, I'm so very sorry. That must be so very difficult, having early onset Alzheimer's. A few questions, and if you're still on, throw them out in the comments and I will try to integrate them in. Early onset Alzheimer's, how old are you? What is your situation? Where do you live? Do you live with somebody? Do you know whether you have what we call mild cognitive impairment or early onset, or is it already dementia? So I'm going to go in answering this question, from the early onset. I'm going to say, okay, you got to be between 50 and 60 years old, somewhere around there. You might be already in the mild dementia phase. What can you do to help your balance? So when people start to progress through, what a good guess that was, Miss Andrea. I'm very good at guessing, aren't I? So she's 56 and has early onset dementia. Okay, so people at the beginning stages of dementia, mild dementia, can actually learn new information still, and they can what was I going to say? They can benefit from rehabilitation. Okay, so what I would recommend, Andrea, is I would find in your area, I don't know where you live, I don't know where, what your situation is, but I would see if you could find somewhere to do some outpatient physical therapy to actually address your balance. So balance in general has a lot of different components. Some of them are physical, right? So early onset dementia has physical, so you're in the States, great. So I would go look for outpatient physical therapist, and I would be working right now from a rehab perspective. I can do things to change myself to be able to improve, because there are two phases. There's the rehab phase where people can improve certain things, and then there's a phase when things change over from being able to, the person themselves, the person with dementia themselves, being able to benefit and improve because they can still learn, to what we call the habilitation phase, which literally just means we change the environment, we change the caregiver, we change those kinds of things to keep the person safe, but they cannot learn anymore. Medicare kicks in 1.5 more years. So I would assume you don't have any insurance at all, or perhaps limited insurance. Do you, if you have insurance, can you benefit from that? If not, what I would do is I would start to, that's great, great. Thank you for giving me that, because that gives me something to work with. I would go and I would join some Facebook groups that have, and I'm going to write myself a little note. I'm not ignoring you all. I'm just going to write a note to Andrea, that I want to send her to a group. Andrea. So what I'm going to do, Andrea, is I'm going to send you to a group. There are some Facebook groups that work with people with balance, where they will do a couple of, there are a couple of things where there's some free resources where you can maybe get some exercises. You can get on YouTube, look up higher level balance exercises. There's a lot that you can do for yourself at home to work on your balance, so that you can keep it and maintain it and improve it. So that's where I would start. Do not, for any, anybody, back to the balance, right? We have, balance consists of just, your inner ear, your strength, all of your range of motion impacts your balance. All of these things impact your balance, but your balance centers are usually, can be affected by thinking processes changes. And then also, over time, your cognitive changes can start to impact your ability to maintain your balance. But in reading your comments, Miss Andrea, I would say yours right now is a physical reason. There's a physical reason for you to have difficulty with your balance. So after this live, and it may be this afternoon or it might even be Monday, but I will, in the comments, I will link you with some physical therapy balance groups that I'm aware of. And I want you to join those groups and get active in those groups and see if you can use some of their free resources, okay, to kind of get you in the right space to help you. Because I know if you can do it at home, you're going to do it, okay? Great job, Miss Andrea. So the next question was from Gina. Hi, Gina. Good morning. Your mom is always in the house and nobody comes to the house. You don't think you should give her the COVID shot? You know what, Gina? I think that it is a very personal decision. I think in the circumstances that you have described, in the limited information on that comment, is that obviously your mom either lives with you or she is homebound, and she doesn't have a lot of people come to her, and you don't think that you need to give her the COVID shot. So I think that is a very personal decision. I think you know your mom better than anybody else. Nobody can tell you. People can make recommendations regarding the COVID shot. They cannot require you to take it, right? So if mom is mostly in the house and there's no caregivers coming in, And you might want to then, in order to protect her, you might want to consider getting the COVID shot so that you don't take something to her if you're the one in and out or if she lives in your house. Um, Nobody can make that decision for you. I have my observation, because I think Gina was maybe on at the beginning when we were talking about Lori's question about COVID and the COVID vaccine. Um, I think, Gina, that you know your mom the best. Um, I think my observation, and this is just my observation, is that we don't know enough. I have seen some people with underlying medical comorbidities not do super great after the vaccine. But I think that if you are afraid of getting COVID, that you should be that you should get vaccinated so that you protect your mom. That's what I would do. Like I said, nobody can tell you regarding this what to do. I don't think there's enough information out there. If she's staying with you and you're her primary care provider and you're not going anywhere and you guys have limited people coming into the house, then try to just, hand washing, social distancing when people do come to your house. You know, I don't think it's a bad idea, people. I really don't think it's a bad idea. If people come to your house, make them go to the kitchen, wash their hands. Don't give them a towel, give them paper toweling, have them dry their hands. And always, if you want to protect yourself and your loved ones in your own home, have them wear a mask. I think that's, I'm not super keen on some of the stuff that we are doing and having to do, but that certainly is how we have been trained in home health, to go to people's houses. Every single patient's house I go to, because I work in home health, every single patient's house I go to, I wear a mask. I don't require my patients to wear it because I should, but I don't, because it's their home and it's their decision to make. But I'm required to wear a mask. And so I wear a mask every single patient's house I go to. I wash my hands, I wear a mask, I've had my vaccine, and I've not had COVID. So, it's anecdotal at best, but hey, that's all we got to do, right? Is everybody's in this boat right now together. Nobody knows really exactly how it's going to play out, how long it's going to go. So far there are no more new questions. It's about 8:30, and I'm going to just read my little welcome statement again in case you're here on the replay or the live. This is the Baffled Brain, Demystifying Dementia. It is a weekly hour-long Facebook Live that will teach you everything you want to know about how to manage dementia. Today is February the 13th, 2021, and this is episode 12. And I'm your host, Lizette Cloete from Think Different Dementia, where we believe caregivers deserve reliable answers to prevent burnout and improve their quality of life. Nobody should navigate this journey alone. And so I had a question earlier on actually somebody who emailed me in the comments. In the comments at the top, I actually put my email address. This is not a what's the word I want to use? This is not a empty promise. If you email me, I will email you back. If you have a question, if you message me, I will answer you back. I usually ask people if I can use those questions in this live stream. I've made myself a goal of trying to answer 1,000 questions this year. So you guys are going to have to hold me accountable. I might have to start to do a little running tab how many questions I want to answer. In 2021, I want to answer 1,000 questions, dementia-related questions for you guys. So I'm trying to be very active and proactive about that. So Clarice had a question. She said this is going to be kind of long, so I'm going to answer Clarice's question. She says her husband is in the early stages of vascular dementia. Although she believes he's had it for a while, he has been good at covering it up. Still, sometimes sometimes he's still good at covering it up. He was diagnosed with vascular dementia in 2018, and his memory is getting worse. He seems to remember things. She says he seems to remember things when he talks to other people. But with her, he doesn't work as hard. He has a lot of vascular issues in his legs. He has back problems and recently had a stent put in for blocked artery. The doctor tells him that being active and getting proper rest will help him with the vascular dementia, and that walking will help him with the vascular issues in his leg. Instead, she says he stays up all night until 4 or 5 o'clock in the morning watching TV and then sleeps most of the day in front of the television. She mostly goes to the doctor's office and they go to the beach. He has diabetes and hypertension and takes a lot of medication. The problem is he doesn't seem to care about his health. He doesn't bathe unless she makes a comment about it, and when she says something about walking and staying up late, he gets irate. So that's the behavior. She feels like her hands are tied. She doesn't know what to do. And then the crux of the matter, the true question is, do I treat him like a child and insist on him walking and going to bed, or do I just say, oh well, he's sick, and let him live his life the way he wants it? I think sometimes that's what he feels, but he doesn't want to talk about it at all. And he's getting worse. He'll look at TV, but I ask him what just happened. He doesn't remember. He's 73 years old. And so I'm going to condense that into a question, a brief question. So when you have a loved one who, so her husband has vascular dementia, so we know that he is not getting enough blood supply probably to his brain. That's what vascular dementia is, right? So her husband has vascular dementia. He was diagnosed in 2018. He has been declining. He's on a lot of medication, and he is not initiating doing his self-care. He's staying awake at night, and he's not sleeping. And he's sleeping during the day. He doesn't initiate doing his self-care. So that's kind of in a nutshell Clarice's question. So what I'm going to say is, okay, the first thing is vascular dementia. Is a very progressive thing. He's not getting enough blood supply to his brain, and that's causing the dementia-like symptoms. So it's a little bit different. The cause of the dementia is different. A lot of the symptoms or the progression, the continued trajectory down is going to be the same. It presents a little bit different with each person, but pretty much people with vascular dementia continue to decline just like people with Alzheimer's dementia. So as people, and this is where I like the functional assessment staging tool, which is a retrogenesis model, which means going back to the beginning. So if we think about our loved ones, ourselves, we are born, we learn to walk, talk, go to the bathroom, get dressed, etc., etc., all the way to adulthood, right? And then we kind of maintain it. And then with dementia, then we kind of decrease back down through it. So what'll happen so as normal people progress, right? There's a point in time when I, as a parent, am telling my child what to do, how to do it, when to do it, why to do it, because they're not able to do it themselves. We have to initiate their tasks. It's time to take a shower. It's time to go to the bathroom. It's time to go eat. As parents, we know to do that with our children as they are growing up. There comes a point in our children's lives and as we develop that it goes from us initiating their activities for them to them initiating their own activities for them, right? And that's as we start to get here to the 9 to 10 to 11 to 12, the tweens, the in-betweens, where we're starting to initiate doing things by ourselves. We don't need somebody to tell us to go get dressed. We don't need somebody to tell us to go get food. We don't need somebody to tell us to take our medicine. We may need some oversight, that kind of stuff. So what happens with vascular dementia, any type of dementia, is as people are progressing, retrogenesis, going back through the almost the same developmental stages, there's a tipping point, right? There's a tipping point where this is progression and this is regression, right? And where my arms X, that's the point right there where they X. So somebody can, where they X like that, there's a point I'm trying to make, the point where that intersects, if you want to think about it, is that at some point or another, people with dementia lose the ability to initiate their own activities. It's not that they don't want to do it, it's that their brain's not telling them it's time to do it, like my brain's telling me it's time to go to the bathroom, or my brain's telling me I'm hungry. So when people with progressive dementia get to a point where they have lost the ability to initiate the next thing, they won't initiate taking a shower. They won't initiate taking going to bed. They won't initiate eating. They do need somebody to help guide them, not do for them necessarily. There comes a time when it is time to do for a person with dementia, but at the beginning phases and for a long time as we're walking with people with dementia, you don't have to do things physically necessarily for them. You have to cognitively do things for them, which means verbal cues, initiating things for people, being able to say, honey, it's time to take a shower. Don't argue about it. If he says, I've taken a shower yesterday and it was a week ago, don't argue about the fact that he hasn't taken a shower, but try to get a routine. So it's not necessarily, Clarice, that your husband doesn't care about his health. It's that he doesn't necessarily know that he needs to care about his health anymore. He's maybe lost that ability to anticipate the secondary consequences. Oh, if I don't take care of my blood sugar, if I don't take care of walking and being active and exercising, then my vascular issues are going to get worse, and therefore, I need to do these things. So I would definitely encourage you, and for people watching, I actually did email her a very comprehensive answer about this. I would encourage everybody who has loved ones, spouses, parents living with them, whoever, you're the primary care person, you can control the environment. I would encourage all of you to have a very structured routine. Routine is our friend. Routine is my friend, routine is your friend, and when you have cognitive impairment, routine is certainly your friend. The more standard routine, a daily routine, a circle of life you have in your own home with your loved ones with dementia, back to the model of retrogenesis, right? Children need a very structured routine. So as children, just as children need a very structured routine, if you have a daily routine that you always do the same stuff at the same time, and your children now, and you go on vacation, and they have the witching hour, and life is crazy because everybody's routine's out, right? Things might be a little harder because you're on vacation. So you go back home, right? Those kids, they get back in the routine. What happens to children during the summer vacation, right? They're out of the routine, life goes to pot. So adults with dementia, people who have cognitive impairment and are progressing through a dementia process, routine is their friend. The better structured routine you can keep them in, the better their everyday functioning is going to be. So back to what Clarice said, is he stays up until 4 o'clock. He won't maybe initiate going to bed. Your job is going to be to get you guys slowly back on a routine. Your job is going to be to establish that routine So you're going to have to work on establishing that. I'm not saying, drop the ball, drop the hammer on him saying boom, 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 but you're slowly going to have to move things back to be a more normal routine. And then your job is going to be to keep that routine and maintain it, because your husband likely isn't able to do that anymore. And it's not, I don't want you to treat him like a child, Clarice, because that was one of your other comments, is treating him like a child. He is an adult. But what you want to do is you want to walk with him, right? You want to give him choices, but limited choices. You don't want to let him make his own decisions global. You want to let him make specific decisions about concrete, specific actions. It is time to, for example, we are going to take a walk. Do you want to take one now or in an hour? Limited choices. Not, do you want to take a walk? Because here's the strategy, guys. Anybody who's watching this, anytime you say to anybody, me included, right? Anytime you say to anybody, do you want to? They have a choice. They now have a choice to say no. So that as a therapist, I never tell anybody, do you want to do X, Y, and Z? Because I'm directing the care. I say to them, it's time for us to do this. Let us do this together. How about we go do X, Y, Z? So for her husband, who she said she doesn't want to treat him like a child, give him choices, limited choices. We are, like a statement, we are going to take a walk. Do you want to do it now or in an hour? That gives him two limited choices. Later on, your loved one may not be able to make a decision between those two choices. Hey, Melissa, don't make me feel bad. Melissa is an occupational therapist, so we know one another outside of this group, so it's kind of fun. So give him limited choices between two things later on. You might have to not give him choices and just say it's time to do these things. So Ms. Clarice, I hope that answered your question. I love for you guys to ask me questions. And Gina has another question or a statement. She says, yes, it works. Routine works. Since stopped working, your mom is not fighting her anymore with giving showers. I gave it to her and she doesn't bite any longer. The routine has a lot to do with it because you're home with her. You know what, Gina? Like I know you commented on that at that time, because that was what we were talking about. But yes, routine is your friend. So anybody who is watching this live, I want you to comment live. If you're watching it on the replay, comment replay. Melissa, do you have any questions for me? Melissa and I both are in this dementia space. We both specialize in dementia. Melissa, I don't know how long you were on. I don't know if you have any comments, but we were talking about trying to keep people in a very structured routine and how that would help them with their potential challenging behaviors at home. I'm trying very hard not to use the word negative behavior, because I don't, the more I've been thinking about it lately, people don't necessarily have negative behaviors. People have challenging behaviors, right? And unless somebody asks me a question, I'm just going to ramble for another 5 minutes or so. I'm actually doing the South Carolina Occupational Therapy Association's annual conference at 9, so I'm going to hop off here probably at about between 8:50 and 8:55. But let's talk about challenging behaviors for a minute, right? So challenging behaviors are common, very common to people with dementia. And what is a behavior? So a behavior is as a result of our loved one who has dementia, or a person who has dementia, not being able to communicate a desire. So when my husband and I maybe have an argument or a fight, right? We don't have very many, but say we have an argument or a fight. Over time, over almost 30 years of marriage, we've been able to piece together we're usually tired. We're either hungry or, there's an external trigger to it for the most part. We're usually tired or hungry. So if we remember that when we struggle to communicate because we're now arguing, right? And we back away and don't engage right at that time and come back later, then we typically seem to do well in resolving the conflict. So people with dementia who have challenging behaviors are trying to communicate something to you. So I'm just going to use Gina's little blurb she used there because it's kind of still up on my screen. So she shows out of her comment that she was working full time, she stopped working, and now her mom is in a better routine, and now there's no fighting when she gives her showers. So there could have been a lot going on at that time in the household because Gina's trying to get ready to go to work. The routine might have been very sporadic. She might have had a shower in the morning one day, in the evening the next day. Her mom might have been picking up on the fact that Gina was stressed. So we look at three things, right? So when we're trying to determine how a challenging behavior is triggered, we're going to be looking at three things. We're going to look at the patient, the person themselves, the person with dementia. We're going to look at the caregiver, because we bring something to the table, and we're going to look at the environment. So in Gina's little comment over there, I look at this and I see three things. I see the environment was the routine, right? The environment changed. Gina, the caregiver, changed because she stopped working. So Gina might have been stressed. Gina might have been tired. Gina might have had too much on her plate. She was trying to juggle keeping her mom safe and overseeing and making sure that she has everything that she needs. And her mom was exhibiting a negative behavior, a challenging behavior, not a negative behavior, Lizette. You just said challenging behavior. So her mom was exhibiting a challenging behavior, and her mom, the person with dementia, was trying to communicate something to her. She couldn't say to her, Gina, when you're rushing, helping me take my shower, it's making me stressed and scared. I don't know what's going on. Or Gina, because you're giving me my shower morning one day and evening the next day, I'm confused. I don't know what to expect. I don't know when I'm going to get my shower because nothing's the same every day and it's different, and it scares me because I can't tell you it scares me. I bite you and you give me a shower. It could be that now that we are doing things in a slower, more systemic way, that her mom is feeling way more comfortable with it. So as we're looking at challenging behaviors, we are always, as clinicians, looking at three things. We are looking at the environment that the person lives in. The environment definitely changed, the routine changed. We're looking at the caregiver of the situation, and we're looking at the person who has dementia. And if you can always keep those three kind of in a balance, you start to really change those challenging behaviors. So if you had watched this and you have loved ones who are having challenging behaviors, reach out to me. I love to dialogue with people. I love to answer questions. This is to serve you. I have a goal for myself. I am so excited about this. I made a goal for myself. I've got about 5 more minutes before I hop off. So I'm just going to read to you again. I'm going to tell you what my goal is. I've made a goal for myself for this live stream, which is called The Baffled Brain, Demystifying Dementia, which is a gift I give to this Alzheimer's and dementia support group, and then I post it up in my private Facebook group too, which is called Think Different Dementia. And then my goal for myself that I made for myself this year, and I just made it, and I'm going to have to try to figure out if I'm on track or not. But my goal for this year, in order to serve this community, is to answer 1,000 questions this year. 1,000 dementia-related questions this year. So I want you guys to ask me questions. This is my gift to you. So I'm going to I'm going to get ready to hop off here because I need to be somewhere else at 9, and so I'm gonna close off with this again. Or if there are any questions, this is my little spiel. Any questions, comments, clarifications, or confusions. So if you have any questions, comments, clarifications, or confusions, please message me. Please post them in the comments here. Like I said, if it's live, post live. If it's replay, post replay. I will put this up again later on today on my YouTube channel, and then also again in my other Facebook group. I want to thank you for watching the Baffled Brain, Demystifying Dementia. This is an hour-long Facebook Live where I will teach you everything you want to know about how to manage dementia. And today is February the 13th, 2021, and this was episode 12. And my name is Lizette from Think Different Dementia, where we believe caregivers deserve reliable answers to prevent burnout and improve their quality of life. Nobody should navigate this journey alone. I hope you have a wonderful, blessed day, and thank you for joining me today. Bye, guys.